Good morning. I'm Major Robert Krell. I'm a general surgeon in the 779th Medical Group here at Joint Base Andrews. And with me is part of our inauguration's Joint Task Force Medical Readiness Team. We have Major Amy Svanberg, Sergeant Perry, and Airman Willis, who are all part of our Advanced Trauma Life Support providers. Today, we're at the Andrews Air Force Base Media Day. We are given a demonstration of a simulated trauma emergency with which to showcase our team's trauma preparedness and medical response skills. In this simulation, a bomb has gone off and we have an injured man with a badly injured left leg and difficulty breathing. Go ahead, team.
Sir, try not to move your neck. What hurts?
There's an amputation to his left leg.
Can you get a C-collar applied?
Applying pressure.
Good call, Perry.
Sergeant Perry is controlling rapid bleeding by applying manual pressure to the femoral artery and then a tourniquet.
Go ahead and get him started on some oxygen.
Meanwhile, Major Svanberg and Airman Willis are stabilizing the patient's cervical spine and giving him supplemental oxygen to help correct any shock he may be in. Since Sergeant Perry has already stopped his bleeding, she's going to establish how the access so the patient can get fluids and any life-saving medications we need to give in the field.
Can up the oxygen and flowing oxygen at 15 meters per minute.
Okay.
Oxygen is flowing. And check breath sounds.
16 gauge left AC inserted.
As part of our trauma assessment, Airman Willis is going to check bilateral breath sounds to see if the patient has any traumatic lung injuries.
Right lung is clear.
Excellent.
No left lung sounds.
1000 cc's normal
His
saline
chest
in.
doesn't seem to be rising and falling equally. His trachea seems to be deviated slightly to the right. I think he's got a tension pneumothorax. Let's go ahead and needle decompress him.
Major Svanberg is concerned for a tension pneumothorax, which is life-threatening and can kill a patient in minutes.
On 3,
Airman Willis
2, 1.
is going to treat it by performing a needle
Sir, do
decompression
you feel like you can breathe better now?
by sticking that needle in the patient's left chest.
Excellent. I'm glad you can feel it.
He releases any pressurized
Sir, do
air
you
inside the
need-
chest, which could be making the patient die. And then he reassesses the patient to make sure the intervention works.
Left lung sounds clear.
Excellent. Strong work, Liz. Any allergies to any meds, sir? Are you currently taking
At
any
this point,
medicine?
Major Svanberg goes through a quick history of the patient
Any
to get a
major
better
medical
assessment of his
problems?
medical
Checking
issues
out
that may
invisible
influence his
injuries.
Okay,
post-trauma
and when was the
care.
last time you
Checking
ate?
for crepitus.
Okay, and what do you
At this
have,
point, we're
sir?
getting ready to get him prepared for transport.
Excellent. All right, so we're going to get you packaged up to go to the nearest trauma center.
Equal
Our
bilateral
transport team
pulses
should be
in the
here
radio.
any second.
So this process of assessing
How you doing, sir?
the patient, stabilizing him, and preparing him for transport takes about 2.5 minutes, during which time we treated 2 life-threatening injuries, a tension pneumothorax in the left lung, and a traumatic left amputation with rapid bleeding. The #1 preventable cause of death in trauma patients such as this is uncontrolled bleeding, which is why rapid bleeding control is so important to provide them a good outcome. In this particular case, Sergeant Perry used pressure and then applied a tourniquet, which is something that we learn in tactical combat casualty care as part of our standard medical training. These are techniques that our airmen know and practice day in and day out as they prepare both for patient care and for deployments. Here at Andrews, we're also proud to partner with other leaders around the Capital Region to push bleeding control tactics like tourniquet use, training, and stop the bleed initiatives across the DoD, not just to our medical providers, but to all personnel. So you wanted a final word? And just a final word to anybody attending the inauguration. Be aware of your surroundings. If you see something suspicious, speak up. And of course, dress in layers, prepare for the environment, and drink lots of water.